Welcome to episode 21 of About IBD. I'm Amber Tresca. Featured on this episode are Shawntel Bethea of Chronically and Brooke Abbott of Crazy Creole Mommy Chronicles. This episode was recorded in April at Healthy Voices in Chicago. April is National Minority Health Awareness Month. Shawntel and Brooke are both African American, and they agreed to discuss the topic with me because, first of all, we weren't really aware that it was a National Health Awareness Month. And second of all, because it's coming to the forefront that we're seeing the disparity in the IBD community and how minority populations are treated and discussed. And Shawntel and Brooke give a lot of their perspective on being diagnosed and being managed with inflammatory bowel disease while being African American. Shawntel's from down south, so you will hear her lovely accent. I realize now I didn't ask them to identify themselves on the pod. Rookie mistake. And stick around for the end. I'm going to include some outtakes because we did an awful lot of laughing, even though it's a serious topic. Here we go. April is National Minority Health Awareness Month. So I have Brooke and Shawn here to talk about some of the topics that are involved with minorities in inflammatory bowel disease. Can both of you explain to me a little bit how being a minority has affected how you've interacted with your healthcare providers or even with advocacy groups in the IBD space?
I think being a minority, it's harder in all aspects of healthcare. I know when I go to the doctor, if I'm seeing a new doctor, sometimes I feel like they expect less of me, if that makes sense, or they don't think that I'm as educated about my disease or really anything as I am. And I feel like that's common. I know that there was a thing going around on Twitter where a nurse shared a story about her patient, and her patient was always being turned down for pain medication, and it turned out that her patient was a nurse. So, I mean, I feel like that's a really big issue, just always assuming the worst or these random stereotypes that I don't even know where they come from. I was diagnosed at 17, but I had been having issues years before that, and I just couldn't get a diagnosis because it seemed to me, looking back on it, that it was a mix between my insurance or my healthcare or the lack thereof, but also the fact that it's like, oh, little black girl just coming in complaining about pain, like she's just being over dramatic or she doesn't know what she's talking about.
Yeah, I think that overall we have an issue with stereotypes in this country, and that tends to plague people of color or people of a certain financial status in every aspect of life. But when it comes to healthcare, because areas that are predominantly have more people of color in that particular area, they usually have less access to certain things, and that includes education on health. So you have just a cultural thing too, where most, and I can only speak for the Black community because that's where I was brought up, but because we've had to take care of ourselves and our own for so long, a lot of Black people tend to self-diagnose because you know that if you go to the doctor, you will get you might think that it's this, but really this is what it is. It's very patronizing. It's very condescending. There's also a huge perception before you think of a patient, you think of a drug addict. So I know I go into the ER knowing that before they see me as a patient, they see someone who is a potential drug addict, which is hilarious because that's not even remotely close to the case. But I think that it's just an overall arc of a theme here in the country where we treat people of color as a different type of citizen. We somehow don't see them as educated. We are constantly surprised when someone of color accomplishes something or speaks about something or is articulate in their speech or passionate about something outside of sports and music. And that's unfortunate because it's truly affecting patients with chronic conditions, especially IBD. No one, for some reason, thinks that people of color can have IBD. It is thought to be a disease that is for the Jewish community only. And because I'm fair-skinned and, I look biracial or whatever, the first question out of everyone's mouth is, "Are you Jewish?" I'm like, that's actually the one thing I'm not. I'm literally everything else but Jewish. And so then you're fighting that. Then it's, well, are you sure that it's IBD and not IBS? Or I was diagnosed with lupus a couple times. I had someone tell me that I had sickle cell, which is not even remotely close to the symptoms that I was having, but they saw my color before they heard my symptoms. So that's, it doesn't matter how educated you are when it comes to your disease. We see stereotypes in this country. We don't just see color, we see stereotypes before we see anything else.
And so how does this impact patients receiving care, especially when it sounds like even getting the initial diagnosis of IBD for a minority is going to be challenging because they're going to diagnose you with all these other things that they are incorrectly associating with the minority community before they're actually looking for IBD?
Well, the impact is felt mostly in the areas where there are no IBD centers. So there are no resources in towns that are predominantly African American, Latino, Native American, anyone who is of color that lives in, the wrong side of the tracks in Detroit or Chicago or even in South LA. I can't even tell you how the difference between me going to Cedars-Sinai and going to USC is huge. But someone who lives in an area like Compton has, USC available to them, but there are no IBD specialists there. So the first thing that you're diagnosed by, the first person that you're diagnosed by is probably a general GI person who doesn't think that you take your healthcare seriously, who's going to tell you that your diet is poor and that you probably have something like lupus or diabetes, and you don't even know that IBD exists, and you don't know that there is a center 20 minutes from USC to go to get a proper diagnosis. So that's the lack of resources in the communities that are predominantly of color is pretty big.
And then I feel like because we are aware of these stereotypes and we're aware that we're treated differently, then we're also afraid to even take that initial step in going to the emergency room or go into the hospital because I don't feel like dealing with this type of person, or I don't feel like being dismissed, or there's, like we talked about, the financial situation. I'm going to be paying a $300 copay for someone to send me home. Mm-hmm. So there's that. And then, like you said, the resources. So I always say that I love my GI, but I love my GI as a GI. I'm aware that he's not an IBD specialist, and I'm also aware that if I saw an IBD specialist, then I'm sure it'd be miles different. So yeah, I do wish we had more resources available and more resources aimed at us, if that makes sense.
Oh yeah, there's a health fair that the county does, Los Angeles County does, that is geared towards the African American and Latino communities. They have a nutritionist there to talk about eating organic, even though there isn't a grocery store within miles of that area that carries organic vegetables and fruit, or really proper fruit and vegetables, but that's a totally different story. And the only specialists that they have are people from the diabetes, asthma, heart disease, and lupus areas. There isn't a vast majority of specialists that go to these health fairs to talk about all the different things. I feel like if, and I've done this, but it isn't received very well because there's nothing to back me up. If you have a group of advocates that went into some of these Black churches and senior meetings and town halls and some of these community groups, and we talked about just talked about our symptoms and what we went through, maybe there will be a couple light bulbs going off. But what you have is you have a couple light bulbs going off, and then it's, well, I don't know where I can go for that, or I don't have the money to do that, or they're not really gonna, take me serious. Or they could go all the way up. They could go all the way up to see that doctor, and then the doctor's like, oh, well, you have pain, go ahead and take a Tylenol. It's interesting how more women of color giving birth are turned down for pain medication postpartum than women who are not of color. We have the same pain. We have all the same stuff. And I just don't, it's really interesting. And what's frustrating is it's not talked about a lot because there is probably someone right now who's listening to this, who's thinking that I'm blowing this out of proportion, that I'm making it about race, that I'm pulling the race card, that I misunderstood, or that I probably didn't articulate something well enough, or that I wasn't listening, or that I didn't try hard enough. It is incredibly frustrating that when it comes to a person of color trying to explain the acts of discrimination that they face almost on a daily basis, that a person has the audacity to look them in the face and say, that's not what you heard, or that's not what you saw. Our feelings are constantly minimized. Constantly. Especially in healthcare. When it comes to healthcare and politics, it's like we're being over dramatic.
And I feel like that's why we become so closed off. We have these stereotypes against us that, Black women have attitudes, or they're mean, or whatever, what have you. But it's almost like we have to close ourselves off from getting hurt, because we know that if I bring up these issues, if I open up to you, if I say what I'm going through, you're just going to either deflect or minimize it or what have you.
Yeah.
And it's hard to constantly go through that. And some people will say, well, you should always talk about it. Well, when you've spent your life talking about it, and also spent your life getting rejected, getting minimized, like being treated this way, I mean, eventually you get tired.
You get tired. You're exhausted. And I always try and bring it up, the fact that when you see a lot of these ads, or when you see a lot of information, it's not, we're not represented, and as soon as you bring that up, it's like, oh, well, why is that a big deal? Well, it's a big deal because you have a whole group of people that think that they can't get this disease because they don't see anybody with the disease. I have really worked hard, and asked constantly for groups that are associated with the IBD community, nonprofits, to focus their energy on reaching out to people of color, to talk to publications that are that have, you know, people of color as a demographic, because they don't know that this disease exists. And I guarantee you there are people who are living with this, that have been living with it for a long time, that think that they just got to push through, that it's just, you know, it's just whatever, it's not that big of a deal. And we've, as a community as a whole, we've always had to make things not a big deal. We've always had to be on our P's and Q's and, you know, on top of our game with everything, and also have had to not make a big deal out of the serious things, so that we aren't perceived as the angry black woman, or, you know, pulling the race card, or being dramatic, or whatever. So there's a lot of energy that goes into being a Black American.
Right.
It is. It's frustrating. I think that we could change true healthcare. You know, we talk about coverage all the time, and we're waiting for the politicians to give us coverage or to change the laws on coverage. But to change true healthcare, there are so many things that we could be doing that we're not doing. And one of them is going into communities that are predominantly Black and Latino and Asian and Native American and you know, all these communities that are of color, and literally talking to them about IBD and what it means and what it feels like and how to maneuver the disease within their culture. That's a huge thing too. You know, I mean, I make non-spicy Creole food. A lot of my cousins don't like it. I get it. But that's how I have learned how to maneuver in my culture. I've learned how to normalize IBD in my family because it affects the whole family. It will affect my whole community. And it's important because my culture is important to me. My food's important to me. My way of celebrating holidays is important to me. But so is my health, and they should all be blended together. But I've been fortunate enough to be able to have the resources to be able to do these things. And a lot of people just don't have that support. I mean, can you imagine being at someone's like family reunion or cookout and being like, oh, you know what? I can't really have your potato salad because it's got such and such in it. And what's the first reaction that you think someone's cousin or aunt's gonna give you?
Right, like you're bougie.
Oh my God, that is... Boy, stop. But that's because that information is not available. And so you don't have that support. You know, we already don't have enough support in IBD as a whole, but when you start breaking it down into these subdivisions, it's really frustrating. I always say it's easier to be vegan in the Black community than it is to have IBD.
Yeah,
it is.
Yeah, it's funny because, like, going back to representation, I sat on a board, and the research has already been released now, but they surveyed a bunch of IBD patients. I forget how many, and I was the only Black person on this board, and 2% of the people surveyed were African American. And I'm like, so you want me to review am I like representing the 2%? Because I feel like you don't even necessarily need me because you didn't reach out to my community.
And that's the other thing. I will get the pushback, well, we don't have a lot of data on patients with IBD.
But are you reaching out? Yeah, we're here.
We're definitely here. I got a cousin that has Crohn's.
Yeah.
I mean, that's, you know, 2 Black people she's my first cousin. That's 2 Black people in one immediate family. So right. I don't understand. We're definitely here. We just don't know that we're here. A lot of Black people don't know that they have IBD. I mean, for a long time, they thought I had lupus.
Yeah.
I joke around a lot, and I think that's just another defense mechanism that I have found in most Black families is, you joke around a lot. You make fun of a lot of things, and you tease each other a lot. But this is a serious problem that is plaguing our community that can be fixed, but nobody is stepping up to fix it. This whole health month, I haven't seen, first of all, I think one group reached out to me and they didn't do anything. I'm here, I'm there, You have publications who aren't really promoting it because we don't really talk about health in our community, but we don't talk about health in our community because the health community doesn't take us serious. So why would we talk about something that we're just going to get, the brush off with? That is a waste of time. We've got other things to focus on, but, education, keeping our children alive, police brutality, racism at work, the equal pay for women. I mean, we've got all these other issues that it is perceived that we can take care of our health on our own. And we shouldn't have to because we're Americans.
It's such a complex and multifaceted problem that we're facing, and it seems overwhelming. But what are some things that you would like to see from the healthcare community or from advocacy groups that can help us start getting in the right direction?
Well, the first thing is utilize your advocates of color. You have people out here like Shawn and myself who are sharing our stories, being public, putting ourselves out there. Use us to get the word out, to speak to community leaders. You have the Congressional Black Caucus, who are representatives. They are a group of Black representatives in Congress who are able to reach their constituents. Most of them are congresspeople, so they have a personal relationship with their districts. You have the Latino Congressional Congress group that are also mostly made up of congressional leaders who have a close relationship with their constituents. Why aren't you holding town hall meetings with these leaders? Why aren't you holding meetups with some of these advocates in different cities? I would love to see meetups. I would love to see information being passed out in high schools. I would love to see resources that help mothers of color get their children the 504s, because let me tell you, having a child of color in public school and in private school too, but particularly in public school, is one of the most difficult things to go through as a parent, because everything that they do is questioned. Are you sure they're that smart? Are you sure that they really have special needs? Are you sure that they need this? Are you sure that this is that? I feel like they might be this. I feel like they might be that. So the resources of helping to get a 504 or an IEP, all of these different resources would be great to have a backup from a nonprofit. Having a nutritionist or actually a GI dietitian go around to some of these churches and community centers to have a talk about the things that they can do at home to help. Because when you have IBD, there's so many different things, but most people think that the diet will help cure it. Well, for some people, a diet can actually help change some of their symptoms. So why not give them some of those resources? Most people think when they think of a healthy diet, they think of brown rice and kale and all of these things, chia seeds. Well, I could tell you right now, someone in Compton at can't afford or will not buy any of that stuff. And guess what? A person with IBD shouldn't be eating it in the first place. So why not have someone go to a community center in that particular area and talk about the things that they can eat within the culture of their food, within their food culture, and what they can find at a grocery store. Reach out to some of these mom bloggers who have there's mocha moms, and there's the black bloggers, there's We All Grow Latina. There's all these moms that have a powerful voice that you can literally say, hey, can you do a write-up about IBD? These moms who read them, trust them. Why not reach out to some of these publications like Ebony, that's been around for forever? Well, Ebony's out now. Essence is still around. You've got BET. You've got all these some of these black celebrities that can sit up and talk about IBD. For one, my best friend, my big sister, is an actress. She has been through hell and high water with me with this disease. Not one nonprofit has reached out to her to say, hey, do you want to talk about this? Can you use your voice? She's willing to do it, but no one's approached her. I'm sure that someone like Holly Robinson Peete, who gives her voice to autism all the time, if someone approached them and said, hey, I know that you know someone with IBD, can you talk about that? She would be willing to do it, but no one's approached. So that, use all the resources that you would use for cancer or AIDS or all of the other IBD patients. Use the same resources for all your Cedars-Sinai folks. Use them at USC.
All of that was great. Like I was going to mention that about the food and healthy eating and everything. You have to kind of look at your audience. If your audience is not in the financial bracket of what you're preaching about, then that's not. I know in my house, if you say Publix, we're going to be like, oh, you fancy. Like, you went to Publix today. So, Food Line, you can go to Food Line and still get healthy things. So why don't we have somebody come in and talk about healthy shopping at Food Line, or even, hey, you can sponsor a YouTube video of someone literally going into Food Line and buying the things that we can eat, or that, even a healthy person can eat. So, just simple things. Like, I feel like if you start there, then you'll already see a huge change and people already wanting to get involved. If you tell me something that I feel like actually applies to me, that's when I'll start listening and I'll start digging deeper and wanting more. And then just normalizing being Black and normalizing being a minority. Just put our pictures beside the white people who are advertising whatever you're advertising. Like, if I see myself, then I'm more likely to connect with the brand. But also, like, the research, if you're doing a survey and you see that there's only 2% of African Americans that you have surveyed, why don't you dig deeper and say, hey, like, that would trigger me. 2%.
Right.
More Black people have this.
Here. Let
me go to this community and see what's going on. And like you say that you put this survey in doctors' offices. So why not tell the doctor, hey, encourage your Black patients, encourage your Latino patients to do this.
Right.
Simple things that require not even that much effort. I feel like we don't ask for much at all.
No.
Just to be treated as everyone else. Why is that so
right
hard?
There. You said normalize being Black. Right. Why are we so different? We're really not. We all want the same things for our families, for our futures. We all want good health. Let me just put this out there. Black people like being healthy. I feel like I have to say it because, I actually one time had someone say to me that I probably have IBD because of the way that Black people eat. And you know what's funny? Most Black folks that I grew up around grew their own vegetables and had their the first person I knew that bought organic chickens was my grandmother. Like, what? And I also want to say, because we've been talking a lot about minorities that are in financial situations and poor communities. Not all Black folks and not all Latino folks are poor. Even the middle class and upper middle class and the 1%ers who are of color still face health discrimination all the time. All the time. If they, people talk about Oprah and her up and down weight all the time and would joke about it. She has a thyroid issue. She has a health problem, and it should be taken seriously. It was very easy to make fun of her and how she handles her weight and the stereotypes of the heavy set Black woman. And I'm saying all this, and I'm finding myself getting frustrated because it needs to stop.
Yeah.
It needs to stop.
I also wish that there was like a happy median in how healthcare providers address us. Because I don't know if you've noticed this, but it's either they over-explain or they they don't do anything
or
at all.
Or nothing at all.
So, like, I've had doctors to, like, come in. Like, the other day, my doctor was explaining a fistula to me. And, like, I love him to death, but I'm like, are you kidding? Like, I had one 2 years ago. Like, why are we talking about it again?
Yeah.
So I started explaining it back, and he's like, oh, yeah, that's what it is. Like, okay, cool. So,
or,
right. Like, yeah, I do. I know a little bit.
Or if you start getting upset, like I was in the hospital, and they had done a lot of testing, and I was like, I just don't think that I need a third CT scan.
Right.
And as I'm talking, the nurse looks at me, and he goes, okay, let's just be calm here because they can't understand you if you're hollering. And I was like, honey, I haven't even begun to start hollering. But if you would like to, and see, that's where it gets annoying, because before you can even be normal in your frustration, you are already boxed into a stereotype of, well, we know where this is going. And so then they stop listening. So I've always been told, you have to be calm, otherwise no one will hear you. But I see other women going absolutely insane and are still being heard. I see men who are not of color going insane, not even making sense, and still being heard and still being accommodated. But if I show a normal level of frustration because I'm tired, I don't feel well, all of these normal human traits, I am somehow villainized quicker than somebody else.
Well, we don't have permission to feel at all.
No,
we can't have feelings about anything. And if we do, then either it's the like, well, that's not just for Black people because, sometimes, or it's just like completely rejected. It's always rejected.
I mean, we saw it was magnified. The absolute discrimination against Black women was magnified for the 8 years that Michelle Obama lived in the White House.
Right.
They yelled at her for having a sleeveless dress for her official picture. It's just like, really? She's got really fantastic arms. Like, I love her arms. I want to be able to wear sleeveless shirts like that. That's amazing. But it's that kind of nitpicking. You know what I'm saying? That those are instead of seeing someone who was a young woman with children who clearly works out all the time and is a healthy person who is trying to transition and give information about clean eating and all of it, they didn't see any of that. They saw someone who did something that made them uncomfortable. They saw someone who got upset at a certain moment and then she turned into a rager. It's just, it happens so often, and it's bleeding over into healthcare. And it's dangerous when it bleeds over into healthcare. We saw the whole thing with, Serena Williams and how deadly that was. And, this isn't a one-time thing. It isn't. The story of me almost getting the morphine that I'm allergic to, because people don't take you serious when you say things like, I can't have morphine. But because I know that I can have Dilaudid, I am automatically a drug addict. I'm just knowledgeable, and I've been paying attention to the 25,000 times that I've been in the ER of how they give me my pain medication to keep me from upchucking everything that I kind of ate earlier that day. I don't even want to be here. It has taken me 3 days to get here because I didn't want to come to the ER, because I have things to do, because I don't like the way the drugs make me feel, because I don't like being tied to a hospital bed, because I actually don't like Dilaudid at all. But I gotta have it, because if I stay in pain for, God knows how long, I'm not gonna rest and my body won't rejuvenate and downward spiral. But I don't see it getting any better. I had hopes of, when I heard of this National Minority Health Awareness Month, that there would be something positive and life-changing coming from this. But when you have nonprofits that aren't even addressing it, that aren't providing the resources, when you're getting feedback like, we don't have the resources available to do these small Twitter chats, Snapchat ads, community, get-togethers. Send me out. I will go to every Black church in Los Angeles. I have no problem with that. If that's what it's going to take to change some stuff, don't send me to Washington then. Send me to every single Black church in LA County. I will be there on Sunday with a table. I will stand up at the pulpit. I will talk to them as a person from the community. This is what is plaguing our community. This is how we can help each other. Here are the resources that you need. Let me help you. What is so hard about that? We're here.
I don't know what's so hard about that. I honestly don't. I know I'm so humbled by the two of you, and I'm so grateful that you're able to sit down with me and share some of your experience. I can't tell you how much it means. And I know now you follow Black women. You do. And on that note, I want you to tell everybody where they can follow you, because everybody needs to know what you're up to and how we can all participate in making change.
I am, my site is chronicallystrong.com, and you can find me on social media on Instagram, it's Chronically Strong blog, and then everything else is just Chronically Strong.
I'm a little more complicated.
Yeah, I remember from the last podcast with you.
You can find me at crazycreolemommy.com, Crazy Creole Mama on Instagram, Crazy Creole Mommy without the A and the crazy on Twitter, and I think it's just Crazy Creole Mommy everywhere else. I also started a thing with Amber called IBD Moms. It's for moms with IBD. It's a great little space. We'll be talking about all things mom, not just IBD related, but literally everything. Well, I guess it's all IBD related. The proper strollers, what kind of activities that are great and safe for moms with IBD, how to pick a GI, all those really great things. And we'll definitely be addressing moms of color with that group, and you can find IBD Moms everywhere. We've got a great little event happening this Friday. Moms Got Out will be on Facebook Live, I think Saturday, and what else we got going on? The website will drop in June, so that's where you can find us.
Thanks, you guys. I really appreciate it. Let's have a great meeting. Our meeting hasn't even started yet. Healthy Voices.
She wanted to say something. I just quickly wanted to say thanks, Amber, for having us, because I think that you are probably one of 3 sites that actually have addressed this not being a minority site. You are the only non-minority site exclusively that has addressed this issue this month, and I appreciate that. And you go, girl.
I know. Thank you.
Yeah.
And it was her idea, too.
Yeah, it was.
I wasn't even thinking about it. I was like, good idea.
I wasn't going to bring the black thing, too, about IBD.
I love that, because it's like, I listen to a podcast called Pod Save the People that I love, that is run by African-American activists. And one of them said he was having a conversation, and somebody said to him, "Why you gotta make everything about race?" And he said, "I would love to not make everything about race. The world is making everything about race." And that hit me so hard. And the disparities in the IBD community for minority populations and for women are astounding and upsetting and disgusting. This is something that I can do. So, thanks.
Thank you.
All right.
I just want to clap, but I know that would mess up the audio. So I'm not going to do it.
Let's fake
Do the fake clap. Thanks, you guys.
Thank you for staying until the end, my super listeners. I want to keep this conversation going. Please get in touch with me all over the interwebs as About IBD. You can find Shawn at Chronically Strong, and you can find Brooke at Crazy Creole Mommy Chronicles. Stick around for 1 or 2 more minutes. You'll be delighted with a few outtakes. And remember, I want you to know more about IBD.
You're gonna stop laughing? You can't laugh every time.
Right. Really try.
Stop. This is a serious topic.
We'll be talking about stuff like this because we are moms, and some of us are of color. And yo, Chicago. No. This is good to know that we're live at HEV in Chicago. I don't know if you could hear the big, ginormous, I don't even know what that was that went behind me. So let me start that again. Let's just try this again.
Back it up.
Back it up.
For National Minority Health Month, I'd like to talk to Brooke and Shawn about some of the issues in the IBD community that minorities are facing. You are going to ruin my podcast. Stop it. There's nothing else I can do. It's not funny.
No, it's not. It's totally serious. I am serious.
I'm leaving it in.